you said you can't just take them out and then magically you'll feel better, all the time, and so I had a lady come to me who said, "I had my breast implants, taken out. I don't feel any better." And I was like, "Well, what are you eating and what are your lifestyle factors? And have you had your hormones checked?" And, the list went on and on. She hadn't done any of that. She just was like, "No,
Sure.
I
Yeah. Yeah.
felt crappy, so I went and took them out." So they need to do all the other tests and things or work on their diet and things
Right.
before they just go take them out, correct?
Yeah, we don't advocate. In fact, you can't actually have any form of surgery with me without running our program. So the book I wrote behind me, Sharp, is about our methodology looking at genomics, toxicity burden, gut health, hormone balance, triggers in diet, um, metabolomics. Like you have a standard Western workup where you used to have surgery and you may need to get your blood count checked. So I look at breast implant illness as you just said, a chronic inflammatory process of which implant is playing a role. And you don't know how much or how little of a role that implant is playing, but just if you follow the scientific literature and you look at, basically what's found after explant, there's always typically chronic inflammation found in the tissues around it. And then from a symptom inventory standpoint, our patients, clinically do better. Now we have a pretty aggressive, program when it comes to helping them with toxicity and then helping them, get better through a series of holistic treatments. It's a little bit more complex than, or it's quite a bit more complex than somebody just explanting and magically they feel better.